All right, class. The last video cut off earlier than I expected, so we are going to finish the remainder of the muscles here. We had left off talking about the muscles of the thigh, okay? Muscles on the front, the quadriceps femoris. We have four muscles. We have the sartorius, and then we have the adductor group, which you can see in this window here that we normally see on a full diagram of the human muscles. In that window we said was the iliopsoas, the iliacus and the psoas major, and then the pectineus, then the adductor longus, and then the gracilis. Okay? Deep and not visible would be the adductor magnus and adductor brevis. Now we're going to move down into the muscles of the lower leg. Just stopping here in the table, I want you to know that the extensors of the knee, your quadriceps, are all innervated by the femoral nerve. Okay, the femoral nerve innervates the front of the thigh. Okay, the quadriceps muscles. It also innervates the sartorius and the pectineus. Okay, but what I want you to know is that the quadriceps is innervated by the femoral nerve. Okay, your hamstring muscles, okay, your hamstring muscles are the biceps femoris, semitendinosus, and semimembranosus. Those three muscles are innervated by the sciatic nerve, okay? Sciatic nerve is on the back, the femoral nerve is on the front of the thigh, okay? And the middle group, the adductor group, is innervated by the obturator nerve. Those are the three nerves you have to know in the upper thigh. All right. So we're going to move on here to the muscles of the lower leg that are acting at the ankle and the toes. Okay. So these are the principal muscles that we're going to talk about. And again, we're going to go through a compartmental approach to organizing the muscles of the lower leg, because there's a lot of them. But if we break them up into these different compartments, it becomes much easier to understand their unified action, as well as their innervation and, in fact, their blood supply as well, which we won't even touch upon. Okay, so first, a posterior view of the calf, okay, of the lower leg. Here's the knee, here's the ankle, and the most superficial muscle is the gastrocnemius. It has two heads, a medial head and a lateral head. They insert, or they are connected to the Achilles tendon, or the calcaneal tendon. Okay, calcaneal for the calcaneus bone. Remember, that's the heel bone. This tendon is the largest, thickest tendon. It's about as thick as this marker. And it's very thick because it has to endure many times your body weight in tensile strength. Okay, because as the gastrocnemius contracts, it lifts up on the heel and you get that explosive jumping or running movement. Okay, so the gastrocnemius produces plantar flexion. Okay, just in a minute I will demonstrate that. The muscle that is just deep to the gastroc is the soleus. You can just see a little bit here and here. If we completely remove the gastrocnemius, we can see the soleus here. Okay, soleus is named because it looks kind of like a fish. A sole, S-O-L-E, is a type of fish. Okay, so it's kind of flat and broad like a fish. Okay, imagine here's the tail, here's the head, etc. Okay, the soleus and the gastrocnemius both insert onto the calcaneal tendon, the Achilles tendon, and therefore they're both doing the same action, which is plantar flexion. Okay, so if I don't hit my head here, okay, this is dorsiflexion, plantar flexion. Okay, dorsiflexion, plantar flexion. Plantar flexion is involved in pushing off to jump or run, press the toe into the ground. Okay. We have the plantaris, which is this tiny little muscle. We're going to ignore it because nobody cares about it. This muscle here that is just superior to the soleus is the popliteus. Okay, it is in the region of the popliteal region. Okay, that's the region behind the knee. It covers on a diagonal behind, it's the posterior tibia, and the popliteus's function is really to unlock an extended knee. Okay, so if your knee is here, it is locked. Okay, the popliteus is used to unlock the knees. Okay, so locked, unlock. So you have to think, we just talked about earlier that one of the muscles involved in locking So we extend the knee, so the muscles that are used to extend the knee, okay, are the quadriceps. But then to lock it in place, we talked about the tensor fasciae lata, okay, which really is inserted on the IT band, which crosses the knee joint and helps to lock the knee. So the opposing muscle to popliteus would be tensor fasciae lata, okay? One is for locking the knee, one is for unlocking the knee. Okay. All right, popliteus, okay, gastrocs, okay, and soleus. As we go deeper, we're going to run into a group of 3 muscles in the posterior compartment that we're going to call the Tom, Dick, and Harry muscles. We'll get to those in just a little bit. And then we're going to also see 2 muscles on the lateral side. From the anterior, we're going to see 3 muscles in the anterior compartment as well. Okay? It's really easy if we go back to this figure. Okay? So we're looking through a cross section through the calf. Okay? This picture shows here's the knee, here's the thigh, here's the calf. We're running through it at about this level. Okay? This one's okay, but I'm going to use the other one because it's slightly bigger. So we're running right through transverse section through the calf. We've talked about the gastrocnemius. Now this is a left leg, okay? So this is the left leg as you were looking at the back of my calf like this, okay? Here's the tibia, here's the fibula, okay? Everybody feel your tibia, okay? And the shin bone. Right here you're gonna feel just a little bit of skin, and quickly you're gonna feel that hard shin, okay? There's not much tissue between it and the skin. Okay, and just at the anterior, you feel a very sharp ridge. That's right here. It's the tibial crest. Okay, and lateral to that is the tibialis anterior. So your shin bone is located very anteriorly within the whole lower leg. Okay, and the fibula is lateral. So behind, okay, posteriorly, we talked about gastrocnemius. Okay, medial and lateral heads. Okay, and then deep to that, we talked about the soleus. Okay, all of those are in the superficial posterior compartment, indicated in the dark purple or the navy blue. I think it's more purple than blue. Okay, gastrocnemius and soleus are here. Those are all enclosed into one compartment. Okay, they are superficial. If we remove those, in the hot pink here would be the deep posterior compartment. And those have 3 muscles, okay? The Tom, Dick, and Harry. Okay, here is tibialis posterior, that's the T. We have the flexor digitorum longus, that's the D. And then we have the flexor hallucis longus, that's the H, okay? So we talk about the Tom, Dick, and Harry muscles. In the back in the day, you would refer to just random males as any Tom, Dick, and Harry. So T, D, and H is for the tibialis posterior, the flexor hallucis, and the flexor digitorum. Okay? Notice that we are on the back side of the leg. So as these muscles extend down towards the ankle, their tendons wrap underneath the ankle along the bottom of the foot, and they connect to the bottoms of the toes. Okay? So let's just think for a minute about how we think about toe flexion extension. If we remember our hand, our fingers, if this is finger flexion and finger extension, then the same action would apply to the feet, okay? Because the toes would have toe flexion and toe extension. So when we extend the toes, we're raising the toes up. When we flex the toes, we're curling the toes under. So these are all flexors, okay? Flexor hallucis, that is flexing the big toe, curling the toe under. And then flexor digitorum, that's curling digits 2, 3, 4, and 5. Okay, and they're easy to remember because there's just 3, and they exist in the posterior compartment that's deep. What's really convenient about this is that there's on the anterior compartment there is another 3 muscles, and guess what? Also Tom, Dick, and Harry. Okay. Same names, except we flipped just one word, okay? Tibialis anterior, that's the anterior-most muscle here, okay? Extensor hallucis longus and extensor digitorum longus, Tom, Dick, and Harry. So Tom, Dick, and Harry in the back, Tom, Dick, and Harry in the front. So it's an easy mnemonic for memorizing those muscles. All right? Okay, they're extensors. So when you're extending the toes, you're raising the toes up. Okay, they're located on the front of the shin. They run down the front of the shin. Their tendons reach across the top of the foot, and they attach to the digits. Okay, this one is to digits 2 through 5, and this one is to the first digit, the hallux. The tibialis muscles are always involved in plantar flexion and dorsiflexion. Okay. Another chief activity of the tibialis anterior, because its tendon is running on the medial side of the shin, is to participate in inversion. Okay, inversion. This way. Okay, remember when we talked about foot position? To invert is to position the bottom of your foot towards the midline. To evert is to position the bottom of the foot away from the midline. So eversion, inversion. Okay, eversion, inversion. Okay, we don't do a lot of that during the day, but what we do is to balance on our feet. Okay, so if we are balancing on one foot, we're doing a lot of little micro inversion, eversions, and these muscles here help with balance. Okay, so tibialis anterior participates in inversion of the foot, okay, as well as dorsiflexion. Tibialis posterior participates in plantar flexion. Okay, the main plantar flexors are the gastrocs and the soleus, but because it's posteriorly linked, located, it also participates in plantar flexion. All right, the last compartment here is the lateral compartment. Lateral compartment is here shown in green. There's two muscles, the fibularis longus and the fibularis brevis. Okay, fibularis is named after the fibula bone over which those muscles sit. Okay, the old word that you might see is the peroneus. Okay, the peroneus longus and the peroneus brevis, because again, this bone has two names, the fibularis or the peroneus. So these muscles in the older textbooks, you might hear the peroneal muscles of the peroneus, longus and brevis. Okay, their function is to act in eversion. Okay, inversion is point the sole of the foot towards the midline. Eversion would be to angle the foot outward. Okay. So it's going to be contrasted with the tibialis anterior. Those are the compartments of the lower leg. Okay, 1, 2, 3, 4, 5, 6. Those are Tom, Dick, and Harry's front and back. The two muscles of the major plantar flexors, soleus and gastrocnemius, and then two in the lateral compartment. Okay, the fibularis longus and brevis. Then you have the plantaris, which we ignore, and the popliteus, which unlocks the knee. Okay, those are all the muscles in the lower leg. So very similar diagram here. Okay, these are kind of complementary figures. Let me get some. Didn't bring my eraser, Sam. So I apologize. Gotta bring my eraser with me. Okay. All right. Anyways, understanding the compartments helps us understand innervation and blood supply. I'm not going to ask you to know innervation on the lower leg. I want you to know innervation of the upper thigh, though, for now. All right, so if we go down, again, we talked about the posterior view here. Okay, here is your tibialis posterior. Here's your fibularis longus, fibularis brevis. Those are the two on the lateral component. Okay, this is your right leg. Here's your fibularis, flexor digitorum longus. And on this side is the flexor hallucis longus. Okay, so these three muscles right here, Tom, Dick, and Harry. Okay, on the posterior side. If we look at a lateral view, we can see tibialis anterior in the front. We work our way to the side. We have fibularis longus, gastrocnemius, and the soleus is slightly deeper. Okay, all those muscles on the superficial layers should be recognizable from a diagram. You should be able to recognize these muscles on a diagram. The deeper muscles that are not visible here, all the Tom, Dick, and Harry muscles outside of tibialis anterior, okay, you will not be able to recognize because they're deep. The medial view, you can see gastrocnemius, you can see soleus, and just a little bit of tibialis anterior here on the front. All right. You can see here, you can appreciate that these muscles that are kind of buried deep inside of the calf or lower leg, all of these have tendons that reach down and wrap around the ankle bones, okay? And they run down underneath. So these muscles and their tendons, because they have this kind of pulley action, they're going to be involved in what type of toe movement, okay? Flexion, flexing the toes. Okay, the muscles that are located on the front of the shin, they have tendons that run down through here across the top of the foot, and they're going to do what action? Okay, extension of the toes. Okay, so these are your extensors, and these are your flexors. Okay, and because of their position and where the tendons are being held, it will give us an indication of their action. Just like we talked about the retinaculum in the wrist that are kind of holding and forms like a wristband to hold the tendons tight around the wrist, you also have a retinaculum in the ankle. Here's the superior extensor retinaculum, okay? And then there's also other retinaculum that holds the tendons on the other side. Okay. Here's the superior retinaculum, and here's the inferior retinaculum. There's actually two of them here that are holding those tendons in place. When you roll an ankle, you're going to be damaging part of this retinaculum because it's really the tendons that are inferior to the lateral malleolus which get damaged when you roll an ankle. All right, those are all the muscles in the body. All the foot muscles, don't need to know about them, okay? So there's abductors and flexors, and they're all the brevis because they're all intrinsic to the foot. I'm not going to ask you about foot muscles. Alrighty, that is all of the muscle content for exam 3. See you guys in class.